Welcome to the Nutrible MD Podcast. I'm your host, Dr. Brandon Lim. If you're seeking wellness, happiness, balance, and wisdom in your life, you're in the right place because all of the original content is designed to push boundaries and expand your horizons in an unconventional way. I incorporate all the clinical knowledge from my father's 50 plus years of experience and my own 25 plus years of helping people with various needs. Today, I'm going to discuss some of the most common observations I've collected from all the patient care and counseling I've delivered over the past 2 decades. I hope you find it useful and see if the concepts apply to you. The more you know, the more empowered you are. Let's begin. One scenario I have seen over and over again, amazingly, from many of my patients is that we often crave exactly the things which are harmful to the weakest parts of our physiology. It causes damage mentally, physically, or both. And we're not even talking about addictions. That's easy to understand. For example, someone is craving a cigarette. We know that smoking creates all kinds of health problems, from lung disease to different types of cancer. However, we are now actually talking about scenarios which are much more subtle or hidden. One good example is in the phenomenon of high blood pressure. So let's say someone comes to see me regarding treatment of high blood pressure. When I start investigating into what kind of cravings that they have, for example, if they gravitate to certain types of foods, it's really often that I hear that they gravitate towards savory foods. Now, what's wrong with gravitating towards savory or salty foods is because when you consume more foods with sodium, and the sodium in your body, especially in your blood, is of a higher concentration, what happens is that it holds on to fluid. Just like when you blow up a balloon, the more fluid or gas that you blow into the balloon, the higher the pressure, right? Well, the same thing happens basically in the human body. When you're craving salty foods and you consume most of your foods with higher amounts of sodium, if your body is not getting rid of that sodium, it's going to hold on to that. And what happens is that that sodium then retains the fluids. And then, basically, in a way, your blood vessels are more engorged. And therefore, what happens? You get higher blood pressure. Blood pressure is controlled by a complicated mechanism with many variables. But let's say we have a person whose kidneys are very efficient in kicking out the excess salt compared to others. And if this person happens to crave salty foods, at least whatever's coming in, they're able to efficiently kick it out. So therefore, their sodium wouldn't be as concentrated, and therefore, you're going to have a blood pressure that should be relatively stable or at least shouldn't go up as much. But what I've found is that it's actually the exact opposite. The people who have high blood pressure are exactly the ones who have weak kidneys, especially in the Chinese medicine sense. So therefore, they're craving salty foods, eating a lot of them. And then what happens is that their kidneys is not good at kicking out that excess sodium. So what happens? They retain the salt. And therefore, they're worsening their high blood pressure problem. Another common situation I see involves blood sugars. Let's say someone is pre-diabetic. They're already having insulin resistance or some other problem with metabolizing blood sugars. Guess what? They're the exact people who are craving sweets or starchy foods. Blood sugars are also controlled by a complex mechanism with a lot of variables. Let's say we have someone who has a good amount of muscle mass. Let's say they're not even physically active, they're just sitting in front of a computer. But because muscle is so biologically active, even if they're not physically exerting themselves, the muscles are actively burning up blood sugars. So if they happen to eat a little bit more carbohydrates in their diet, what happens is that at least the biologically active tissue is able to burn off any excess blood sugars, and therefore their blood sugar levels should not be outside of the range. However, let's say someone, in terms of their body habitus, has more fatty tissue. And since they have more fatty tissue, they have higher insulin resistance. Those are the people that I find also gravitate towards sugary foods or starchy foods, and they're worsening their problem. They don't have a way to burn off the sugars efficiently, either because they don't have enough muscle mass or their body weight is higher in body fat percentage. Well, those people end up to be many times the ones who crave the sweets, who crave the starchy foods, and in fact, just worsening the weakest parts of their physiology. Let's discuss some situations where the correlation is very subtle or even hidden, but the effects rendered are tremendous. I see many patients with acid reflux or heartburn at my private practice. These are patients that might have gastritis or even esophagitis. These are patients who might have had H. pylori tested or even treated. Many of them have had a gastroenterologist consultation or even an endoscopy to check out the upper GI tract for problems. They might be on one, two, or maybe even three medications, but their symptoms are still really severe. So, what about these patients? One pattern I've seen a lot, often over and over again, are that these patients love to consume foods with garlic. Now, consuming foods with spiciness, things which are spicy in nature, we all know it's going to irritate the upper GI tract and cause the acid reflux or heartburn to get worse. But how about garlic? You'll be surprised how many people with severe acid reflux come to me for consultation and they're consuming garlic in some form on a daily basis. We're talking about cooking with garlic. For example, using garlic salt, marinating meats with garlic, using it in stir fry, consuming hummus, you name it. Basically, using garlic in some form on a daily basis. Well, one of the key advice I would give to these people with severe acid reflux symptoms is to stop using garlic in their cooking. You'll be surprised how many people have reported so much better in terms of their symptoms with or without the use of the medications that they're normally on. Now, don't get me wrong, I'm not anti garlic. I think garlic does have health benefits. And just like my belief in all foods have their risks and benefits, it has to fit your physiology. So, in this situation, if you have severe acid reflux and garlic is being consumed on an almost daily basis, make sure to try eliminating it and see how you feel. Nothing's 100% that will work for everybody, but this is something that I've seen over and over again. And this advice has helped a lot of people. If you have severe acid reflux and you've done basically a lot of things to try to help it, and one thing that you haven't tried is to eliminate garlic from your diet, try it and see. One of the clinical correlations that I have noticed over the years, and is surprising to many people when I discuss it with them, has to do with migraines. Now, we're talking about migraines that could be very mild in nature, and the person just has to use a medication every so often to control the bad ones, versus the really severe ones, and they have to be on a daily medication for prophylaxis. So, what is it that I have found regarding migraines in terms of correlating with something that weakens that person's physiology even more? We're talking about spicy foods. I have found that many people with really bad migraines, when they consume spicy foods often or they gravitate towards spicy foods, it makes their condition much worse. Now, what is it in spicy foods that might be causing the problem? In the Chinese medicine sense, spicy foods burden the liver organ system. Now, again, for people who have known me through my private practice, they know that when I talk about the liver organ system in the Chinese medicine sense, it does not totally correlate with the liver in the conventional scientific sense. So, when I talk about the liver organ system, especially in conjunction with the kidney organ system, in effect, it's analogous to the endocrine system, the hormonal system, in the scientific sense. So, in Chinese medicine, spicy foods burdens the liver organ system. And whenever you have an imbalance in the liver organ system, migraines is one of the symptoms that can occur. The strength of this clinical correlation does vary with the sex and age of the individual. It is the strongest for perimenopausal or postmenopausal women. So let's say I have a patient that is starting to have perimenopausal symptoms like hot flashes, trouble sleeping, anxiety, and for example, they also have migraines. One of the key advice I would give is to stop having spicy foods. And this could be in the form of jalapeno peppers, chili peppers, the stopping the use of condiments like Tabasco sauce, sriracha. And many of these women come back and say that their migraines are less intense and less frequent. Now, that doesn't mean that this correlation doesn't work for males. I've had young men who crave spicy foods, love to eat it most days of the week, and they're able to stop the consumption of spicy foods. Well, their migraines also get better. From the topic of migraines, let's switch over to the subject regarding fatigue. Being tired all the time is usually multifactorial and can involve multiple variables working at the same time. Many times, it's just blamed on stress. Maybe there's actually physiological issues causing the fatigue. So let's say for our discussion, we have a patient that goes to the primary care provider asking for an evaluation. Things that would be done would include checking labs to look for anemia, looking for blood sugar problems, looking for hypothyroidism, even looking for antibodies to a previous Epstein-Barr virus infection, which would suggest chronic fatigue syndrome. There could also be testing outside of lab work that look for sleep apnea. Usually, the thorough evaluation reveals some source or sources of why the patient is fatigued all the time. But there are actually many cases where a thorough workup does not reveal a source at all. By the time most patients come to me to ask for a second opinion as to why they're fatigued all the time, they've had a thorough evaluation already by their primary care doctor as well as specialty consultations. The correlation I'm going to bring up now, there are several items that needs to be noted. First, it's not 100% applicable to everybody out there with fatigue, but it's definitely something that needs to be investigated because it could be at the end the primary reason why the test has not revealed why they're tired all the time because there's no testing for it. Number two, this correlation is not mutually exclusive of other variables, meaning that the patient could be tired due to some kind of physiological or psychological reason. And this factor, if not addressed, will add to the problem and may be one of the main causes as to why, after treatment, the patient is still tired all the time. So, the observation I have seen over and over again throughout the years for patients who have chronic fatigue despite a relatively normal conventional medicine evaluation has to do with low qi energy. And this is qi spelled QI, like in qigong exercises. Specifically, I check with my patients with chronic fatigue as to whether or not they love to consume foods directly from the refrigerator, especially raw fruits and vegetables. But it could also be iced water, fruit juices, cold smoothies, ice cream, yogurt, and even salads. We're talking about cold temperature foods directly from the refrigerator or freezer. When a patient with chronic fatigue tells me that they consume a lot of foods which are cold in temperature, I need to note that because that's probably the primary reason why they have low qi energy. To make this even more complicated, it doesn't have to be cold temperature. It could be actually consuming too many food items that are energetically cold or cool. We're talking about the subject of food energetics. We won't go into this today because that could be a whole podcast in its own. But just note, if you consume a lot of foods cold in temperature or consume foods which are energetically cold or cool, then it's very likely that your chi energy will decline over time and that low chi energy will translate into chronic fatigue. I'm going to conclude today's podcast talking a little bit about sleep. Many people experience sleep problems. Could be in the form of having trouble falling asleep, not getting enough sleep because of work schedule, waking up multiple times during the night, or just not getting enough deep sleep. Whatever the cause is, most of these individuals will end up being tired during the day. And what happens? If these people also happen to love the taste of coffee, they would use this caffeinated product throughout the day to basically get them through the day. They need that extra kick so that they can actually survive the day of work. Well, what happens? Many susceptible individuals, even with one cup of coffee early in the morning, will end up affecting their sleep in a negative way. So, that sounds like a vicious cycle. You're tired, you're consuming more caffeinated products so you can get through your day. It makes your sleep not as good. You're tired the next day again, you consume more caffeinated products, and the cycle repeats over and over again until the sleep is completely wrecked. Now, there are ways to break up that vicious cycle, just like there are treatment methods to reduce those cravings mentioned earlier in this episode. These cravings injure the weakest elements of our physiology to create all sorts of health problems. In future episodes, I will go through the treatment methods in more detail. I invite you to step out of the box and look at all aspects in your daily life never addressed before. The answer you have been searching for could literally be right in front of you. With what you learn from my podcast, you will develop the knowledge and courage to face those health dilemmas and be the best version of you. Please subscribe and let me know what you would like to learn about, and I will do my best to provide you with the most practical and original content from all my experiences. Know that faith and fate are powerful, but you choose your destiny. Until next time.